as the audience probably knows, there were patients in the N-Momentum trial from all over the world that had different disease backgrounds, so to speak. So there were patients who were newly diagnosed, who were treatment naive with regards to immunotherapy, but there were also patients who had prior immunosuppression, because at that time there were only off-label drugs, and widely used off-label drugs were, for example, azathioprine, mycophenolate, mofetil, and a couple of others. And now this poster, or this contribution to AAN, and by the way also to other conferences, looked at a subgroup of patients who had prior immunosuppression with azathioprine or mycophenolate mofetil, and compared certain demographic and disease characteristics with the immunosuppressant naive group, and then both groups, of course, were enrolled in the N-Momentum trial and received placebo or Inebilizumab. And to sum this up very briefly, there were no fundamental differences between these two cohorts. So Inebilizumab was equally potent and efficacious in preventing and reducing attack risks, both in the group of patients who entered the study treatment naive, as well as in the group of patients who entered the study with a prior history of having been treated with azathioprine or mycophenolate mofetil, and also the safety data were pretty much the same across these two groups.